Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is the Minister of Health, Tyler Shandro, and Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Minister Shandro will open today's update.
Thanks, Tom, and good afternoon, everyone. Today, I'm pleased to announce that we are completing Step 2 in our path forward. Last week, I announced a partial move into Step 2. It was at that time that I announced that we safely eased restrictions on libraries and indoor fitness, but delayed other changes. And we did this because it was the right move. Cases and positivity rates had increased a bit, and we wanted more time to assess the spread and make sure that we weren't seeing a rapid increases of cases throughout the province. And we were being cautious, as we should be. No one wants to see a spike in cases again the way we did in December. No one wants to see more than 900 COVID patients in a hospital, suffering with the illness, straining the physicians and the staff in our hospitals, displacing other patients, and forcing delays in surgeries and other procedures. But I know that many Albertans wanted us to move faster last Monday, and they were frustrated that we didn't. I also know that many Albertans feel very anxious about any measures being eased right now, not wanting us to face another big rise in cases. Now, after a year of the pandemic, both of these perspectives are only natural. As Dr. Hinshaw has said, there is no one exactly right way through this pandemic. Every change is a judgment call, and it's okay to disagree about the details of a decision on any given day. We all want to get back to normal as soon as possible, but not at the cost of a lot more families losing loved ones if we can prevent it, and not at the cost of overburdening the ICUs and other services again. But the situation is changing, and we need to change along with it. We said that we'd complete Step 2 when it was safe to do so, and I believe that it now is. Over the past week, our daily case counts and our positivity rates have fallen. And thanks to the collective efforts of Albertans, our hospitalizations and our ICU admissions have gone down as well. And most importantly, fatalities continue to fall. And they should continue to fall as we vaccinate seniors and others that are at risk as fast as we get the doses in from the federal government. Just last week, I announced that we should be able to offer every Albertan a first dose by June 30th. And that changes the whole picture here in Alberta. The time is right to keep moving safely forward. And at the same time, there are reasons for us to remain cautious. We're not seeing the same sharp decline in cases that we saw in December. Cases have plateaued. And we still have to consider carefully how to get the balance right. But I believe that this step, the remainder of Step 2 today, is safe. Effective immediately, we're completing Step 2 and easing restrictions, which will mean a little bit more freedom for Albertans. First, we're expanding the capacity limit for the retail sector. All retail settings, including shopping malls, can increase their customers from 15% to 25% of fire code occupancy. And this change applies as well to individual stores as well as the common areas like hallways and food courts. Starting today, we're also expanding the Step 1 restrictions that apply to youth and including members of college and university athletic programs. Now, this means that lessons, practices, and physical conditioning are allowed for these programs with a maximum of 10 participants in total, including coaches, trainers, and participants. And remember, physical distancing has to be maintained between participants at all times. Everyone should be masked at all times, except during the actual training activity. As well, we're easing restrictions for child, youth, and adult performances so that folks, individuals, and groups can now rehearse and perform in preparation for filming or live streaming of a performance. And child and youth performances, and this includes dancing, it includes singing, theater, and playing wind instruments, must follow the same restrictions for youth sport, performance, and recreational activities in Step 1. This includes a maximum of 10 people, mandatory masking at all times, and 3-meter distancing between all participants. As well, no spectators or in-person audiences are allowed for any type of activity. Now, adult performers, whether solo or in groups, have a lot of the same restrictions. A maximum of 10 people, mandatory masking, 3-meter physical distancing between everyone, and no audiences. However, larger indoor film productions and other performances will be permitted, provided that there is no audience and they submit an approved plan that follows strict protocols. This includes regular testing as well for everyone included. And this will allow projects like filming movies, filming television shows to occur, provided that they implement proven steps to stop transmission. And finally, banquet halls, community halls, conference centers, and hotels. They can now open for all of the activities that are permitted under Steps 1 and Step 2. That includes hosting permitted performance activities, wedding ceremonies with up to 10 people, and funeral services with up to 20 people. Now, note that funeral receptions, wedding receptions, or trade shows are still not permitted in any venue. Today's announcement includes a lot of information, and remember that alberta.ca will have the details posted to help you understand what's been changed. I want to reassure all Albertans that this is a careful step, it's a cautious step, and we must and we will always be responsible. Though we are easing the restrictions in these sectors, strong measures remain in place to keep the risk of transmission in our community low. In terms of where we go from here, we'll be discussing Step 3 on March 22nd at the earliest. And this will give us time to see what impact, if any, these changes have on COVID-19 in Alberta. To put us all in a position where it is safe to consider moving ahead with the Path Forward plan, we all have to continue to do our part to respect the public health guidance that's in place. And today is another sign of hope for Albertans. More than 300,000 doses of vaccine have now been administered in our province, and more are being given out every day. Almost 100,000 Albertans are now fully immunized with 2 doses, and that includes every resident in long-term care and designated supportive living. Reminder as well, as we announced last week, that we are the first province in Canada to do so. We're making progress. We just need to stick at it a little longer and keep bending the curve for a few more months. Thank you, and I'll now invite Dr. Hinshaw to provide today's daily COVID report.
Thank you, Minister, and good afternoon, everyone. I would like to recognize the efforts many Albertans have made to bring case numbers and hospitalizations down, bringing us to a place where more activities can be opened. But as mentioned, we are not yet in the clear. As I have said before, each time we ease restrictions, we increase opportunities for COVID-19 to spread if we do not continue to follow the important preventive measures required for each activity. So I would like to remind Albertans that easing restrictions does not mean that we can be less vigilant. When we continue to follow all measures in place, we protect one another, we protect our healthcare system, and we protect the progress that we have made this far. Turning to today's update, we have now administered about 297,600 doses of vaccine, and more than 91,000 Albertans are fully vaccinated with 2 doses. It's important to remember that protection from any vaccines, including those for COVID-19, doesn't happen overnight. It takes approximately 2 to 3 weeks for them to be effective. This means that if someone is exposed to the virus in the first week or 2 after immunization, they would not yet be protected, and they could still get sick. This is not a failure of the vaccine or the vaccine causing COVID-19 infection. It is just a matter of unfortunate timing. This reality makes following the public health measures very important, even for those who have been immunized. Over the last 24 hours, we have identified 278 new cases of COVID-19 and completed about 5,500 tests. This puts our positivity rate at about 5.4%. We have identified 6 new cases of the variant of concern, bringing our total to 659. Our R value province-wide is 0.95. It is promising to have an RT value below 1, but we must all continue to do our part to move from the plateau we are seeing to a continued downwards trend. There are currently active alerts or outbreaks in 251 schools, or about 10% of the schools in the province. Currently, these schools have a combined total of 961 cases since January 11th. There are 254 people in hospital for COVID-19 treatment, including 36 in the ICU. Sadly, 6 new deaths were reported to Alberta Health in the last 24 hours. Each life lost reminds us about the serious nature of this virus and the need to protect one another from it. As always, I extend my sympathies to all who are mourning a loss, no matter the cause. With the promising developments that we've had with vaccines over the past couple of weeks, I know there is a lot of information for Albertans to take in, and many questions about who can sign up when. I would like to provide clear information on where we are at with Alberta's vaccine rollout. First, I want to clarify what types of facilities Alberta Health Services is offering immunizations at, as we've received many questions about what qualifies as a congregate living facility. AHS is currently arranging immunizations for all residents in retirement centres, lodges, supportive living and other congregate living facilities with communal resident services such as group dining facilities, where at least one resident is 75 or older. AHS has contacted these facilities directly, and operators do not need to reach out before they are contacted. Settings such as work camps, condo complexes for those over a certain age, or retirement communities are not considered congregate living facilities for the purposes of the immunization program. Individuals in these types of settings need to book their own vaccine appointments through AHS or a participating pharmacy when they are in an eligible group. I would also like to remind all eligible seniors aged 75 and older who haven't yet booked their appointments that there are still spots available at participating pharmacies in Edmonton, Calgary, and Red Deer. You can find a list of these participating pharmacies at Alberta Blue Cross's website. So if you haven't booked your vaccination yet, I would encourage you to do so as soon as possible. I would also like to provide clarity today about 2 upcoming opportunities for booking vaccine. First of all, signing up for the AstraZeneca vaccine is going to be happening later this week, and I know many Albertans have questions. Beginning on Wednesday, we will begin to offer the vaccine to Albertans aged 64 and First Nations Métis and Inuit individuals aged 49 who do not have severe chronic illnesses, and we will offer to younger individuals if the supply allows. As we will only receive 58,500 doses of AstraZeneca this week, we cannot book everyone at once as there are approximately 400,000 Albertans in that age group. This is why we will begin opening bookings based on the year you were born. This means that on March 10th, Albertans born in 1957, those who are turning 64 this year, can contact Alberta Health Services online or can call 811 to book an appointment. As well, any First Nations, Métis, or Inuit individual born in 1972 or who is turning 49 this year can contact 811 to book an appointment. Please do not contact pharmacies to receive AstraZeneca as they are not carrying this vaccine at this time. Once supplies become available for pharmacies of this particular vaccine, we will let you know. We will expand to other birth years one at a time if supply of AstraZeneca is available. As I said, this is a fairly large age group, so it is likely we will not be able to offer vaccine to all those aged 50 to 64 right now. Everyone will eventually have a chance to be immunized, whether sooner with AstraZeneca or later with Pfizer or Moderna when available. I know many are eager, but it is important to be patient. If you are not eligible for AstraZeneca this week, please do not call 811 or try to book online. This would just create longer waits on hold and online for everybody. Finally, the second opportunity coming up next week. I know that many people are eagerly anticipating the start of Phase 2A. Bookings will start for this phase next Monday. Please do not try booking until this starts. When you do, there will be 2 ways to book. Pharmacies will be able to book appointments right away for all those aged 65 to 74 and First Nations, Métis, and Inuit people age 50 and older, no matter what year you were born. Starting next week, 156 additional pharmacies will be available to book appointments outside of Edmonton, Red Deer, and Calgary, for a total of 258 pharmacies administering vaccines across the province. Please refer to the Alberta Blue Cross website for information on participating pharmacies near you. For AHS appointments, to prevent the system from experiencing a surge of visits, they will begin booking online by birth year only, starting with anyone born in 1947 and anyone born in 1962 or earlier who is a First Nations, Métis, or Inuit individual living off reserve or off settlement. Each day following, an additional year will be added for booking purposes. People never lose their eligibility, so you can always book later than the start date, just not earlier. First Nations and Métis people aged 50 and older who live on reserve or on settlement will be able to access vaccine in a similar way to Phase 1 within a First Nation or Métis settlement. Again, this all starts the week of March 15th, so we cannot open appointments at this time to that age group. I am encouraged that so many are eager to get a vaccine, but I want to stress that we need to be patient and that there will be enough for everyone who wants to be immunized. A year into the pandemic, I know everyone is tired of COVID-19 restrictions. Even though we are tired, it is important to remember that widespread immunization is within our sights. In just 4 months, every adult Albertan who wants to be immunized will receive their first dose. Until that happens, all that is standing between another wave of COVID-19 moving into our hospitals is our actions. We are so close to getting there. We just need to hang on a little while longer and continue to do our part for the health and well-being of all Albertans. Thank you, and we'll be happy to take questions.
All right, we'll go to the phone now. There is a very full queue, but we will get through as many as possible. Operator, could you put through the first caller, please?
First question is from Bill Fortier with CTV News. Go ahead, Bill.
Hi, the question is for Dr. Hinshaw. Over the weekend, Dr. Hinshaw, we saw a bit of a jump in cases involving the variants. We see more today. Given how we're getting more of these and how contagious they are, do you have a number, even a ballpark number, as far as what percentage of the population of Alberta needs to be vaccinated in order to sort of stamp out COVID or reach what people are calling herd immunity? And as a follow-up to that, what happens if we do not achieve that level of protection? How does that affect the decisions moving forward? Thanks.
Thanks for the question. First of all, I'll just note that we have been working with the lab for several months now, and because the testing process is quite complex, it's taken us time, and we're still not quite there to fully automate our reporting. So I will just note that the difference between yesterday's report, I believe it was 54 cases of variants yesterday, and today's report of 6 cases is actually a combined total of 60 over 48 hours. We are still seeing an average of about 20 to 30 a day, but unfortunately sometimes because that reporting is manual, sometimes we get a little bit more than 48 hours in a particular booking cycle, so that can unfortunately make it look like some days have a surge and the next day is quite low. So just a caution, again, until we are able to fully automate, sometimes we'll get a bit of variability on one day to the next. With respect to herd immunity, we do know that the variants are more infectious, and so we are looking right now at how we would incorporate vaccine coverage rates into our planning going forward with respect to how that informs what kinds of measures we need, but we don't yet have a firm number. You'll have heard, I'm sure, in the media, there are ballpark numbers, usually around sort of 60 to 70% is what's floated, but it is important that we validate those with, again, that information about the variant and that increased infectivity. And if we don't reach a herd immunity, Again, what we'll need to do is continue to be monitoring for COVID-19 and its impact. The most important thing we need to mitigate, we need to prevent severe outcomes, hospitalization, ICU admissions, and death. And the vaccine right now is looking very good at being able to do that for individuals who receive it. And so again, while we don't know specifically what those percentages are, the best thing that all of us can do is to be vaccinated when it's our turn so that we can protect ourselves and those around us.
Is there a follow-up, Bill?
That's good. Thank you.
Operator, could you put through the next caller, please?
Next is Lucy Edwardson with CBC Calgary. Go ahead, Lucy.
Hi, this question is for Dr. Hinshaw. We heard of a number of cases being announced at Bowness High School and at another high school in Cochrane, Bow Valley High School, where there are more than a dozen cases. I'm wondering, has contact tracers had any luck figuring out whether or not there was a large indoor gathering that occurred that led to either one of these outbreaks?
I've been in touch with my local colleagues, local public health teams who are working on those outbreaks, and there has been a concern floated that may have happened, but I haven't yet received information if that's been confirmed or not. What's really important to remember, though, is that what happens in that school-aged population, it's critical that the behaviors, not just inside of school, but outside of school, are those that prevent the spread of COVID. And so anyone who might be considering having an indoor gathering needs to remember that a single indoor gathering can cause the spread of COVID-19 from one person to many overnight. And that's something that can have ripple effects to many, many other people. And at this point in time, because we don't yet have the majority of those in our population who are vulnerable, that spread can put other people's lives at risk. So please think twice if you are considering having a social gathering, which is currently not allowed under current medical officer of health restrictions.
Is there a follow-up, Lucy?
Yes, and just in terms of, being 1 year into the pandemic and still having these kinds of conversations where you have to remind people not to gather indoor, how frustrating is that for you, and what is your message to those people?
I would say that the pandemic has been frustrating for all of us, and I can understand why people would be feeling frustrated themselves with the public health restrictions. But what I would say to those people who are considering these types of activities is remember that your actions don't just impact you, they impact those around you, and again, not just your immediate circle, but there's a knock-on effect of transmission that flows through all of our networks if we're not cautious. So I know it's frustrating, I know it's difficult, and I would say please hang in there. We are only several months away from a first dose to all Albertans who want it, aged 18 and older, and now is not the time to put our communities at risk.
Operator, could you put through the next question, please?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon. This question is for Minister Shandro and also for Dr. Hinshaw, if both of you want to answer. Let's just fast forward a bit in the time machine to March 22nd. And let's say you're at the podium, one or both of you, and you're talking about whatever the decision is for step 3. And let's just say, just say that the hospital numbers are, for instance, about what they are now, which is under 300. How would you avoid what happened last week where people said, look we're under 450, why are we not in the full step 2? How are you going to be able to message it if, for instance, you decide hospital numbers are under 300, but for whatever reason you state, we're not moving with the full step 3? So we had quite an interesting week last week. How would you deal with, either Minister Shandro or both of you, how would you deal with it if you decided, well, we are under 300, and that looks like what the plan says, but we're not actually going to go ahead for other reasons?
Thanks, Rick. And so what I would say is this is similar to the weeks that we also had during the relaunch after May 4th. As we moved through, we called it then stages of the relaunch plan. Now, these are steps for the Path Forward plan, but as measures are eased throughout the pandemic, and other provinces and other countries are going through a similar process as well, there is going to continue to be frustration and anxiety from both sides for people who think that it's too slow and people think it's too fast. We've made it very clear to people that as we step down measures, it's focused on hospitalizations, and that if we ever needed to pause something or portion of it, or if we ever needed to as well, we always had a big asterisk that we're not out of it yet, as we announced at least in January when we announced the Path Forward plan. And if we ever saw another wave of cases here in Alberta, if there was a need for us to impose measures again, what would we use to impose measures on the province? And it was going to be on not something that would take 14 to 28 days for us to be able to see the information and be able to respond to it, but something that's not a delayed metric like hospitalizations, but something that's immediate, like our cases. And so if we did see increases in our cases that were a concern, if we saw data and information from Dr. Hinshaw in her office that there was transmission was from a certain activity in particular, that whether there was a need for a certain further measure or a pausing of a measure. Now, right now, we don't have those increases of cases. Cases have plateaued. If it continues to have plateaued, we don't see the increases in cases, then there will be no concerns. And we know that it's difficult because people who are anxious, either because the measures are going too fast or too slow, will continue to be frustrated, continue to be anxious until we are out of this completely and have our vaccinations. And that's going to continue to be the case, that people will be frustrated and anxious, but we will continue to make sure that people know if our cases are plateaued and not increasing, or if they're going down and not increasing, that we will be able to continue with each of these steps. And we will have to continue. That's the reason why we have these 3-week windows, for us to be able to look at that information, look at that data with Dr. Hinshaw in her office, to be able to understand when something is continuing to be safe using those lagging, the delayed indicators of the hospitalizations. Thanks, Rick.
Is there a follow-up, Rick?
Yes, I just want to clarify. So say, for instance, on March 22nd, we have 200 people in hospitals. People will look at your chart. Yes, there are other factors, but they'll look and they'll say, well, we're well under the 300, even if it's 254 in the hospital like today. I mean, what is your appeal to them to say, be patient because we're not implementing fully step 3? Because I can anticipate this is exactly what's going to happen on if the numbers are below 300 and you don't activate a full step 3. I mean, are you going to appeal to modeling? Because that modeling isn't coming true yet either. So what exactly do you tell people when so much of the Premier's emphasis has been on hospitalizations?
And it will continue to be an emphasis on hospitalizations, Rick. It will continue to be, with the asterisk that we have to continue for the other, for Albertans who also think that the measures are just fine, don't move them, or that they're actually too soft and they want further measures. People in all three of those categories are going to continue to be anxious about COVID and about the measures and about our numbers. And we will continue to make sure that people are aware that there is an asterisk on moving forward on the hospitalization metric, because as long as and that's the whole reason why we have the 3-week window, is to look at the data and see if there is an increase of cases then that we have to respond to. So we will continue to look at those cases, and if they continue to be plateaued and not be increasing, we don't see any concerns with any of these activities and seeing any concerning transmission during these activities, then we can continue to be focused on the hospitalizations and continue with the remaining parts of the Step Forward plan. Thanks, Rick.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, this is a question for the minister. I know that in February and earlier this year there was some talk of finding our own supply for vaccines, and there was some talk of following Manitoba's lead with Providence. Whatever happened with that? Has Providence abandoned that plan, especially given the Premier's comments today that it's unlikely that any of the vaccines being proposed in Alberta would actually be ready in time to have much of a difference in the current vaccine program.
Thanks. No, continue work on that project, and the focus of that project wasn't just on vaccine manufacturing domestically for COVID-19, but for any future pandemic, and the need for us to be able to work with other provinces like Manitoba and in Ontario. And so a lot of this is work that's being spearheaded, at least for Alberta's government, in Premier's office and with Premier in his conversations with those other provinces. He's also the Minister of Intergovernmental Affairs, and working with them to make sure that we, as provinces, also have a culture, or not a culture, but we have domestic supply of manufacturing vaccines in Canada, so that there aren't concerns about having to rely solely on other countries for their manufacturing. We saw with, for example, in February, as the facility for Pfizer in Belgium was affected, we were affected as Canadians disproportionately than other European countries were. So if that's the case, it's not just for COVID-19, but also for future pandemics, and wanting to make sure that we have a strategy with those other provinces to be able to develop a domestic supply of or an ability to manufacture here in Canada.
Is there a follow-up, James?
Yeah, just back to, so Manitoba signs this deal, again, for the current pandemic and for this year, and there was some talk that Alberta was considering doing the same. So I understand the point of, future vaccines and all that, but there was a very specific, comments made that Alberta was considering basically doing what Manitoba did when it comes to the, this year and the current pandemic. Is that on the table anymore, or has that effectively been abandoned?
I suppose what I'm trying to say is that it's a broader strategy, and if purchasing from Providence is included within that strategy, then it might be something that we consider. But it's a broader strategy that might include procurement through Providence. I also point out, though, that when it comes to the approval of manufacturing a vaccine in Canada, that the approval does come from Health Canada. The same way that Health Canada and their approval process was used by the federal government to require an exclusivity agreement with the federal government, so that a province couldn't procure vaccines from a manufacturer. The federal government may also have a similar requirement if there was an approval process for manufacturing. But I think it's needed for not just for COVID-19 and vaccines for that, but a broader strategy for us to work with these other provinces. If there is an opportunity to procure from province, it would be within that broader strategy.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for Dr. Hinshaw. I believe that if the health minister wants to chime in, that'd be great. So bookings for the AstraZeneca vaccine can start on Wednesday, and the province has said that those who are 50 to 64 years old who do not have a severe chronic illness can receive the vaccine. However, severe chronic illness has not been clearly defined, and there's some confusion around who qualifies. So what qualifies as a severe chronic illness, and will the province be releasing some type of list before Wednesday?
Thank you for the question, and I acknowledge that that is confusing right now. Unfortunately, as we were working towards completing the analysis on that list of chronic conditions, we were really focusing on when our Group 2B would be eligible, which we believe would be in early April. And so we had based our timelines on that. So with the AstraZeneca coming sooner than anticipated, unfortunately, I recognize that the timing isn't ideal for those who are trying to decide if they should get AstraZeneca or not. We will be making that list available publicly very soon. And unfortunately, again, I acknowledge that it's not ideal timing as people are trying to make decisions right now, but we will make it available very soon. It's very close to being finalized.
Is there a follow-up, Julia?
Yes, there is. Also for Dr. Hinshaw, there are some Indigenous people in the province who have expressed vaccine hesitancy because of past treatment from the government and the healthcare system as a whole. What do you say to those who feel this way and are on the fence about getting the vaccine?
I would say that First Nations, Métis, and Inuit people in the province have an understandable reason to be concerned, and at the same time we have been, because of the history of their experience as a people in this country, what I would say is that we've been working very closely with leadership in First Nations, with Métis leadership, to be able to support them and to provide any information that's required so that we can be partners in communicating to First Nations, Métis, and Inuit people in the province, and to be able to provide them with assurances about the safety of the vaccine, about the effectiveness of the vaccine, as well as making sure that they understand the rationale for offering vaccine to First Nations, Métis, and Inuit people, given the higher risk that those individuals have when compared on an age basis to other Albertans for severe outcomes. So again, we continue to work in partnership and do our best to answer questions that come our way and to support leadership in those communities to be able to answer the questions that come up.
Operator, could you put through the final caller, please?
Final question is Elise Stolte with the Edmonton Journal. Go ahead, Elise.
Hi, thanks. My question is for Dr. Hinshaw. Could you tell me how many of the 230,000 seniors in Phase 1B have now signed up for their shot? And when you say all adults who want a vaccine will be able to get one by the end of June, what number are you using in that calculation? I.e., how many adults are in the estimated number of adults who want a vaccine?
Those are very specific numbers, so I wouldn't be able to give them to you right now, but we could get back to you after the availability today with those very specific numbers. We are using census data, population data for the June 30th number of all Albertans aged 18 and over, but I don't have that specific number for you. And again, the booking number for those who are age 75 and above, we'll have to get that for you after the call.
And I would just say this. For the vaccine rollout, it actually does fall under Assistant Deputy Minister Matthew Mercredi. So in fairness to Dr. Hinshaw, we will provide that number to you then offline.
Elise, is there a follow-up?
Yeah, I'm just wondering if there is, because it speaks to that vaccine hesitancy question, I'm wondering if there's a rough percentage that you're going on for that population.
I see. What we've seen in polling data from the last several weeks is that approximately 80% of Albertans who have been asked about their interest in receiving a vaccine have said they're either highly likely or somewhat likely to receive a vaccine when they're eligible. And so as we're planning, we're wanting to make sure that we do have enough vaccine for 80% of that census population because, again, over the past few weeks, we have seen a lot of interest from Albertans in obtaining a vaccine when they are eligible to do so.
Thank you all for joining us. Dr. Hinshaw will provide another update on Wednesday afternoon. Have a safe evening.